folks are most apt to take messages and advice from a trusted primary care physician or nurse practitioner, somebody who they know, who they regularly see, and we're advocating what's called a patient-centered primary care model that encourages individuals to work with their physicians or their nurse practitioners to set goals around health that are attainable. What we're talking about when we say the patient-centered medical home can really be defined by 5 fairly simple concepts. It's about a transformed way to deliver services that first and foremost is centered on the patient. We've got to center everything we do around the patient who is the customer if in fact this movement is going to take off beyond Washington, D.C. and state capitals. And so keep this patient-centeredness piece in mind. It is the heart of what we're talking about. Care coordination comes next, particularly for people who are ill. If you are someone or a loved one is someone who struggles with a chronic illness, what you find to be so difficult as you navigate through the health system is that one set of providers or healthcare professionals doesn't know what the other set of healthcare professionals knows about you as an individual. And so often you are the person who's relaying information back and forth to people who are physicians. But most of us aren't clinicians. And so the challenge we have in making this system work is we've got to have folks who help coordinate this care across providers, across behavioral health folks, social workers, across hospitals, nursing homes, etc. Now, if you aren't sick, which thankfully is the vast majority of Americans, you don't think so much about care coordination because quite frankly, you don't need care coordination. But you do think about accessibility. There is a reason why Walgreens and CVS and many other, Walmart, many other organizations are starting clinics within their own stores. It's because we don't have office hours in the evening and on the weekends. And when inevitably is your kid sick? On the weekends, in the evenings. And so what we've seen is the marketplace is going to respond. It's all about expectations, and this new set of consumers, and I see it with my graduate students in their 30s, they expect things to happen far more quickly. They want information at their fingertips, and accessibility is going to be key to making this work moving forward. We know when we provide better access for patients, they use the health system that we want them to and not the emergency department. So 24/7 access to care does not mean you get to see your doctor 24/7. But it does mean that you have somebody that you can talk to who is connected back to your doctor, who can provide phone or e-consults. You can add telemedicine, group visits, e-consults. There are ways that we can use technology in new ways to inform our provider. The commitment to quality and safety is sort of a given, but you know the vast majority of Americans actually think that information that's stored in an electronic health record in one hospital can easily be sent to another hospital across town. You get that people actually think that interoperability is real. Okay, that's a fantasy. But the care has got to be documented. You've got to be able to track over time and share across providers, and we still struggle with the best way to do this in a world where EHRs are not yet entirely interoperable. The comprehensiveness piece is really important for 2 reasons. First of all, the average American doesn't think of themselves as a disease or a body part or an organ system, and yet think about the language we use in healthcare. Oh, this group of diabetics, or this group of fill in the blank. And so we've got to start thinking about people as whole people and what they need because they've got to be empowered to take care of their health once they walk back out the door after they've seen the doctor, and we'll talk about that more in a moment. The second piece of comprehensiveness is we've got to get over that we need a doctor to see us every time we need an intervention in the health system. The reality is many of the services that we need are provided by nurses or social workers or pharmacists, and there's a whole team of folks around a physician or a nurse practitioner as a leader that can in fact help help a population of people get healthy and stay healthy, and we need to start empowering the whole team. There are a lot of different tools that those practices could embrace, and we find that when they do, they are most influential on their patients. So thinking about themselves differently from just sort of we're a place where patients come when they're sick, and we give them whatever therapies they need, prescriptions, etc., and send them on their way, to thinking about themselves as an entity that manages the population health of their patient panel, and then gives their patients tools and stays in regular contact. That ongoing contact is actually kind of important, but again, it doesn't have to be the physician. If everyone's practicing at the top of their license, then we're using every member of the team's best expertise to help that patient get healthy and stay healthy.